Sex and back pain. Two subjects which may not appear to go together, but back pain is an extremely common medical problem. 8 out of 10 people will someday experience back pain. And one very common and often devastating complication is the loss of comfortable sex between loving partners. We've produced this video to share important, helpful information with both the pain sufferer and his or her partner. Until recently, no one had specifically addressed the problems which back pain caused between sexual partners. However, over the last several years, thousands of people suffering from back pain have read this booklet, Sex and Back Pain by Lauren Andrew Hebert, a professional physical therapist. We'll be referring to this booklet frequently during this program, so keep a copy handy.
There are 3 parts to our strategy dealing with sex and back pain. One is dealing with back pain and its physical complications. The second is understanding the emotional and relationship problems caused by chronic pain. And the third is dealing with the physical performance side of sex, finding positions and activities for comfortable sex. If we deal effectively with physical pain and its emotional consequences, it is possible to have a rewarding sex life, even with a back problem.
Back pain is real. It's important to know this because frequently you can't see the reason for the pain. In fact, even with expert help, you may not be able to discover the specific cause for the pain. But it is real. Let's look at the spine. This is the spine. It's like a spring. It must be flexible. It carries most of the body weight. And the upper part is the neck, which curves inwards. The middle part of the back curves outwards. The lower part curves inwards, which is the lumbar area. Now this has to be mobile, carry heavy weights, and absorb shock. The spine is made up of 24 small blocks of bone called vertebrae, stacked one on top of the other. A hole or channel runs through these vertebrae, making way for the spinal cord, and from the spinal cord comes a complex network of nerves which spread out and go to the entire body. The vertebrae connect to joints called facet joints. They're designed to allow movement in all directions, but they're very sensitive and easily sprained. Between these vertebrae are discs, which are rings of very tough fibers surrounding soft jelly-like centers. Discs act as shock absorbers for the spine, but when overstressed, the discs can be damaged or ruptured. In addition to the vertebra, the discs, and the nerves of the back, there is a complex group of ligaments and muscles which support the spine and control its movement. There are several different types of injuries and conditions which can cause pain, such as bulging or ruptured discs, damaged vertebral joints, torn ligaments, pulled muscles, and pinched nerves. Each injury will leave the person with a position of pain and a position of comfort. The position of comfort is called your neutral position, the position where pain is minimized. The balance of this program is designed to help you discover which sex position most closely matches your own neutral position.
Most couples have sex positions and activities which they like and others that they either don't like or haven't tried. If you find yourself not liking some of the suggestions we make, that's fine. You may have tried something similar and found it unpleasant. But try and keep an open mind. And be ready to try something new, even if you think it odd or unusual. It may end up being very enjoyable, and it may help you avoid back pain.